Panic attacks and meltdowns, while distinct in nature, are both overwhelming experiences that can disrupt an individual's ability to function in the moment. Panic attacks are characterized by intense surges of fear and physical symptoms such as heart palpitations, shortness of breath, and dizziness, often feeling like one is losing control or having a heart attack. Meltdowns, on the other hand, are emotional responses to sensory overload or emotional stress, commonly observed in individuals with autism, which can manifest as crying, yelling, or aggressive behavior. Treatment for both conditions may include therapy, medication, and stress management strategies, tailored to address the specific triggers and symptoms of the individual. Risk factors for panic attacks include genetics, major stress, or a temperament that is more sensitive to stress, while meltdowns are more frequently associated with neurodevelopmental disorders, such as autism spectrum disorder, ASD. Here's a detailed look at the aspects of each condition to better understand their nuances and management. Symptom trigger, psychological stress versus sensory overload. When distinguishing between a panic attack and a meltdown, the key lies in understanding the triggers that instigate these responses. Panic attacks often originate from psychological stressors, an overwhelming tide of anxiety that might descend without warning, where a person feels an intense fear or discomfort peaking within minutes. By contrast, meltdowns are frequently associated with sensory overload, especially prominent in neurodivergent individuals, such as those with autism. Meltdowns are a reaction to an environment that bombards the senses, causing a feeling of loss of control. Identifying the trigger can guide both immediate management strategies and long-term support planning for those affected. Emotional response, intense fear versus overwhelming frustration. When discerning between a panic attack and a meltdown, the emotional response is a pivotal differential aspect. Panic attacks are characterized by an intense fear or apprehension, often with a sense of impending doom. This acute anxiety can cause palpitations, sweating, and a feeling of losing control. In contrast, meltdowns are more associated with overwhelming frustration and stress, commonly seen in neurodiverse individuals, such as those with autism spectrum disorder. During a meltdown, the individual may exhibit verbal or physical outbursts as a reaction to overstimulation or an inability to cope with the immediate environment. Understanding these emotional nuances is crucial for accurate identification and appropriate response. Coping mechanism, seeking reassurance versus need for isolation. When differentiating between a panic attack and a meltdown in the context of coping mechanisms, the behaviors tend to diverge significantly. During a panic attack, individuals often seek reassurance from others as a way to mitigate overwhelming anxiety and fear. They might reach out to friends, family, or medical professionals for comfort and validation that they are not in imminent danger. On the other hand, those experiencing a meltdown, often associated with sensory overload or emotional regulation difficulties as seen in autism spectrum disorders, may exhibit a starkly contrasting need for isolation. They usually require a quiet, minimally stimulating environment to process their emotions and recover from the sensory assault, often withdrawing from social interaction to regain equilibrium. Recognizing this distinction is key for providing appropriate support tailored to the individual's needs. Onset, sudden without clear cause versus gradual buildup with triggers. Panic attacks typically strike suddenly and without a clear external cause, engulfing individuals in intense fear and physical symptoms such as heart palpitations, shortness of breath, and dizziness. They can mimic life-threatening conditions, creating a vicious cycle of anxiety. In contrast, meltdowns are more gradual, often resulting from accumulated stress or sensory overload. Generally associated with autism spectrum disorder, meltdowns display as an intense response to overwhelming situations, leading to loss of behavioral control. Triggers are usually identifiable, such as abrupt changes in routine or overstimulation, making preemptive strategies possible to mitigate their impact. Recognizing these patterns is crucial for appropriate interventions and support for those affected. Cognitive impact, racing thoughts versus impaired communication. When distinguishing between a panic attack and a meltdown in the context of cognitive impact, Racing thoughts are characteristic of panic attacks. During a panic attack, individuals may experience a flurry of anxious and fearful thoughts that can cascade out of control, leading to feelings of unreality or intense apprehension about impending doom. On the other hand, during a meltdown, which often occurs in individuals with autism spectrum disorders or extreme stress, the cognitive impact manifests as impaired communication. The person may struggle to articulate thoughts or needs effectively, leading to frustration and overwhelming emotional distress that impedes their ability to engage in conversation or respond to others. These distinct cognitive disruptions signify different underlying mechanisms and necessitate tailored approaches to support and intervention.